my name is Anna Zalopa. I'm a licensed acupuncturist, and I'm going to make a short and sweet video today. We're going to talk about nursing, and we're going to talk about what it's like to be a working mom. I have, well, first thing I want to say is I've been in practice for 18 years, and this is my 64th video, and the last video was about motherhood. And in the motherhood video, I talked about my birth stories with all 3 children. This one I'm going to be talking about nursing my 13-year-old. I nursed for 2 years and 4 months. And then the second one I nursed for 4 years. And this one is turning 5 weeks old tomorrow, and he's nursing. And on the weekends, on Saturdays, he's on plum formula with my husband. He's with me all the time, that there's really nothing to pump. So he's been so far pretty good on the plum formula. My children, you know, have never been on medications. They've never been on antibiotics. And I attest that to the fact that I nursed for so long. And from age 1 on, they've been on some kind of herbal supplement, herbs or some kind of, you know, supplement, and it's been very, very helpful. And they'll do acupuncture when they need to. The second one is needle shy, so I don't force her to do any acupuncture if she doesn't want to. But if I can reason with her and explain to her logically why she needs the acupuncture, she'll let me do it. You know, the kids don't need a lot of needles, anywhere between 1 to 10. You know, average is 4 to 6 needles. So maybe other acupuncturists do less, maybe other acupuncturists do more. That's pretty much what I do with my kids. My 13-year-old, she'll get like an adult treatment. You know, she's pretty good with getting acupuncture. She's a dancer, so she'll do whatever I need to do in order to be able to dance really well. So, so that's nursing in a nutshell. I do recommend having a lactation consultant. My great friend, Shelly Goodfriend, is here in Orange County, and she's a mother of 5, and she's a doula. So if you're in Orange County, definitely hire Shelly. I believe that the success I've had as a nursing woman is because I had a great coach. So if you're coached really well from someone, you're probably going to take that advice for the rest of your life. And this is our bonus baby. I'm 43, and I never thought I was going to nurse again. And I came back, you know, like being able to teach him how to latch on correctly. I have a patient who came in last week, and I think she's a special ed teacher. She has, I want to say, her 3rd child, and her baby was not able to nurse from her breast until the 9th month. So until then, she had to pump. They did a lot of different types of therapy. I think she's really involved with La Leche League. So she said I can use her as a resource. But that's important to understand, is some women have a hard time nursing. It may not be the mom, it's usually the baby, but they exhausted as many resources as they could in order to get their baby to a place where he can nurse directly from her breast. So I'm happy to have her as a reference, because most women, if the baby doesn't latch within a week or 2, they give up on nursing. But this woman did not give up, and her baby since 9 months, and he's now a 10-month-old baby. He didn't start nursing directly from her until 9 months old. So I think that's pretty special. So, you know, I'm talking about breastfeeding because, you know, here's my newborn, and a lot of people don't realize that I nursed for 6 years and 4 months altogether with both my kids. And when they find out, and I share with them what I feel are the benefits, I mean, a lot of times women wonder, you know, how I'm able to have a practice and how I'm able to nurse. You know, having a business is very, very helpful. I think if you work for another company, you know, it would be a little more challenging, but I don't know, that's not my lifestyle. But if you're able to somehow pump during your lunch or your breaks and store the breast milk, and then, you know, in the evenings breastfeed your baby, you'll go a long way, and if you'll be able to nurse for at least a year. But whatever you can do, you know, do whatever you can do. But if I can tell you that being self-employed and being able to bring my children to work has been very, very beneficial, which brings me to my next subject, which is being a working mom. Um, when I was in school, I didn't have the insight to seeing what it would be like as an entrepreneur. And so it's very helpful um, to be able to have my own office and I can bring my babies to work. Something we don't learn in school, whether it's high school, some college, graduate school, postdoctorate, we don't learn what it's like. We don't learn what we need to in order to make money and also have a family. I just don't think so. It may be different now, but from talking with women in their 20s, it seems like it's still not being taught. I took business classes. I took science classes, chemistry classes, biology classes. I took philosophy classes. I majored in French, so I took language classes. I took liberal arts classes. Um, and I was in Chinese medical school. And when I was at USF, I took different kinds of religious and philosophy classes. I took writing classes. I took math classes. So I had a wide range of classes, and none of those classes did we learn what it's like to be a working mother and how to juggle the time between exercise, taking care of ourselves, taking care of children, cooking, cleaning, running a household, and being a homemaker and not working is an art in and of itself. But this video is especially for working women. And I'm just going to give my own 2 cents. If somehow you can have your own business, I think that would be the best route to go. But I'll have a lot of patients here who are lawyers, doctors, pharmacists, nurses, teachers, writers, scientists. I had a scientist come in today. She's a doctor of environmental science. I have special ed teachers. I have women who, who work for the county. There are all kinds of, child care providers, massage therapists. I have all kinds of women who come in here, and they're coming in stressed out. And I find that the common denominator is lifestyle. They're coming in for anxiety. They're coming in for stress. They're coming in for depression. This particular woman who came in today is 29. She drove from Riverside, and she has some serious issues. She's overwhelmed, ear ringing, headaches, throbbing head, digestive issues, skin issues, and she's fatigued, and she has a low libido, and she's only 29, and there's so much information in her chart. And she drove all the way from Riverside because she needs help today. So today is like her damage control. The reason why I'm bringing her up is because she's like many women who come in, and she's in what I call a transition phase. She graduated in May, and now she's ever since September she's been working 2 jobs as a pharmacist, and she drives an hour to each job, and she commutes. So she has a 2-hour commute every day, and that's not uncommon. So I just want to touch a little bit on quality of life, and if somehow the women watching this, if you want to make your life a little easier, and if you've chosen, like my life, in my family, we've chosen to have a dual family income. If somehow you can do a single family income and you just want to focus on being a homemaker and making the best out of that, I think that would be awesome. If you decide to do what we do, then you got to learn how to take care of yourself. You got to learn how to make time for exercise. You have to learn how to make time to take care of yourself, like getting massages, seeing a chiropractor, seeing an acupuncturist. You got to, whatever, if you see a naturopath doctor, a medical doctor, someone who understands eating right, incorporating different kinds of, not just eating the same thing, understanding how whole foods helps you, understanding supplements, understanding herbs, understanding the benefits to holistic eating, understanding the benefits of exercise, understanding the benefits of different types of therapy, understanding the benefits of talking with other women. Venus on Fire, Mars on Ice is an incredible book. I have a lot of my patients reading that book. So I'm not going to talk about that book, but I strongly recommend that you do follow Dr. John Gray on YouTube and get that book so you understand how your brain works, how your hormones, how your behavioral health, how your chemistry, understanding how your brain works and how it dictates your health is very important. Understanding that you have to sharpen your saw. And this particular woman, who the pharmacist, she's working 4 days a week, 8 hours a day, and she's not exercising, even on her days off. That's not healthy. So there's so much that I do share with my patients here, especially in regards to lifestyle, but you can't expect basically you can't expect to work, drive 30 minutes to an hour one way. I have a lot of women that drive a minimum of 45 minutes one way and to work, and then they have to drive back, and they work all day, 8 to 10 hours, sometimes 12 to 14 hours a day, and you're not exercising, and you're not getting enough sleep, and you're very anxious or depressed or stressed out. You're destroying yourself, and you're going to have issues. You're going to have issues with fertility, digestion. You're going to have issues with your heart. You're going to have issues with so many things. And if you don't want that, if you don't want to come to an office like an acupuncturist or somewhere else, or going to your doctors and you're doing damage control just to live, that's not healthy. I would rather you see whatever kind of medical practitioner or doctor, or your doctor of your choice, and you're in the prevention health situation as opposed to damage control health kind of situation. So that's my public notice for the day is take care of yourself. The reason why I was able to have a have a, I don't want to say spontaneous, but a bonus baby at age 43 is because I've taken great care of myself. And I've learned how to take a 10-minute to a 2-hour siesta every day. More like, 10 minutes to 30 minutes. I'm very busy. My kids are busy. They dance. My oldest one dances 10 hours a week. She's in school. My second one dances 6 hours a week. They take violin. And only in the summer does my oldest one do some jiu-jitsu anymore. But she's still, she's very strong and she loves to do it. But my point is we're very busy. And I make it a point to do some kind of exercise. And it's been a little difficult for me lately because I had a cesarean. And I talk about my birth stories on a different video, so I'll leave that there. But I'm not allowed to exercise for at least 6 weeks. And I feel it. I walk a lot, but I'm not able to do weights. I'm not able to do kickboxing or hip hop or jiu-jitsu or the lots of fun things that I love to do. And I can feel it. So walking is my primary exercise. But there are a lot of people who are not exercising. So please do take my word of advice. And I think every practitioner who's very healthy would say the same thing. Acupuncture and many styles of, healing modalities are very beneficial. But I can tell you this, acupuncture will never replace great sleep. It can help you get great sleep. It will never replace great food. It can help you have a good appetite, not too much appetite, not too little. It can help you. Acupuncture can never replace exercise. It just can't. It can help you want to exercise and have the what you need to do in order to exercise, but you can't replace exercise, great sleep, great food with acupuncture. So you have to make the decision to live well so that you can have a higher quality of life, because many people do come in here very stressed out, and if all you can do is just kind of rearrange some of your priorities, how you think, how you behave, you will live a very high quality life. So I can talk about this all day long, but I just wanted to share that and show you my almost 5-week-old baby. And this is what it looks like when a baby's well fed, and in his case breastfed and changed. He's a happy, content baby. All right, have a great day. If you want to talk, just give me a call at 949-305-1703. I do phone consultations. I do take patients anywhere between 5 to 6 days a week, and I love what I do. So if you are a working woman, I do hope you love what you do, because that is the strength of, that would be a strong source of your happiness. All right, take care. Have a great day. Oh, you can visit me on the web too at moveyourqi.com and committedtobetterme.com. That's moveyourchi.com and committed to a better